important topic to discuss, an incredible study done about type 1 diabetes and how it affects young people, young adults and teenagers. Here to tell us more about it, I'm joined by Dr. Dasgupta. She is the Associate Director at the Center of Outcomes Research and Evaluation. That is an excellent title, by the way.
Thank you.
Welcome to the show. It's great to have you. And Michael Wright, who is a participant, also co-author of the type 1 diabetes stigma study. Welcome, Michael. Great to have you here as well.
Thanks
so let's first of all, let's talk about the findings of the study. What did this study show?
So this is a study about youth and young adults with type 1 diabetes, and it's important to remember type 1 diabetes is a type of diabetes that strikes you out of the blue, usually in childhood or youth. Requires daily management with multiple doses of insulin, either by injection or by a pump that people wear on their bodies, high risk of having low blood sugars that can be fatal, and also a really strong imperative to keep blood sugars not high, because otherwise in the future one can develop blindness, one can develop kidney problems and heart disease. So we wanted to look at the challenges of living with type 1 diabetes, and particularly the scope for stigma. Stigma has been studied in other chronic diseases, and there had been interview-based studies that suggested it was a problem in type 1, but not a larger study.
Okay.
So, and we wanted to look at youth and young adults because this age group is challenged by many life decisions, romantic, educational, vocational, struggles with autonomy. So it's a difficult period in life, and to be hit with a chronic illness that requires so much self-management is difficult. So we got funding from Diabetes Canada.
Okay.
And we conducted a nationwide survey using social media. So we partnered with Diabetes Canada and smaller diabetes organizations from across the country, and they used their social media platforms to encourage their membership to contact us.
Is this sort of the first time that you've really reached out to people that, you know, the patients that...
This is the first time that a study's been done using, in this age group and this condition, a larger study using social media, because typically most surveys, the old days were telephone based and so on, and now times are changing, and it was probably
and easier to get information. Right? That's where young people, that's where you find them.
That's it, exactly. And we were able to recruit 380 youth and young adults from across the country. They answered the survey questions, and the survey was about living with diabetes, but we did ask them if they felt embarrassed managing their diabetes in front of others, embarrassed in managing it in front of their friends, did they hesitate to tell people they had type 1? And 65% of participants endorsed at least one of those three questions.
Yeah, and that's where I want to bring Michael in here. So, Michael, tell us a little bit about that. Did you feel a certain amount of stigma because of your diagnosis?
I definitely associate with some of the definitions we used for stigma in this study. Particularly when I was first diagnosed at 16 years old, I was definitely embarrassed to test my blood sugar or give myself insulin in front of my friends, and feeling stares from strangers and onlookers when I had to do this in public places.
Right.
I definitely felt like I had to hide my condition in some ways.
So, throughout this process, have you felt better about what you've heard and being able to connect with other people?
Yeah, so part of the good thing about participating in this study was that part of my job was to read a lot of the respondents' answers to questions about stigma and how they felt stigmatized or what they did to kind of cope with it, and that kind of helped my own care, knowing that I wasn't alone. So I knew we had to kind of do something, and the team knew that we needed to have a way to connect with other type 1s to kind of help cope with some of the stigma that was out there.
Yeah, and you have connected because you now have an online resource for people that are living with type 1 diabetes to get together, to connect, to share shared experiences.
Exactly.
Right?
So we call it the Virtual Peer Network. And it's accessible for any youth and young adults with type 1 diabetes across Canada. And we use it as kind of a forum for discussion, whether it be serious topics about insulin management, diet, exercise, or even if we want to share fun or pictures or stories that we can all relate to. It's a nice place to do that.
Dr. Dasgupta, so, obviously you've learned quite a bit through the study. Moving forward, what are you taking away from this study? Are you putting together, anything other than this online group?
So I just wanted to highlight, not only did we have a lot of stigma present in this population of patients, but it was linked to having dangerously low blood sugars. So people
Right.
who felt stigma were 3 times as likely to have had a severe low sugar in the past year, requiring help from someone else, and were twice as likely to have blood sugars that were excessively high on average. So there's real implications not only in feeling stigma and feeling bad about that, but in managing the condition. So it's a good question. What do we do about it? And the first is to know what is type 1 diabetes, to know it afflicts younger people. And the more people know about this, the less likely they are to, wonder, is that person injecting themselves? Does he have a drug problem?
Right,
What is the situation? And that's what the respondents told us. They wanted greater awareness. They wanted it to be sort of a routine part of, let's say, a group of characters on television or in a drama, that it wasn't the focus of the drama, but, someone happened to have type 1. Building this online network, which we did, again, with funding from Diabetes Canada and the Canadian Institutes of Health Research, was really helpful. And we're trying to grow that network. We have
and it's great to have you both on to help raise awareness, too, so that people do understand what people go through, because a lot of these things that you discussed, Michael, it never even dawned on me that that you would feel that way. Thank you both for joining us. Really do appreciate
Thank you very
it.
Thanks for having
Great
us.
conversation to have.
Thank you.
Don't go anywhere. More breakfast television coming up, including your headlines and your weather and traffic right here on BT.